Thank you, Honourable Speaker. Honourable Speaker, I was just laughing at the sight of a cat that just walked past somebody's picture. It's probably in a zoo somewhere. Honourable Speaker, I rise to respond to the question raised by the Honourable Dr. Salik Govin. I want to, Mr. Speaker, begin by thanking our loyal and dedicated frontliners and support workers who have sacrificed and put their lives on the line. There are many, and they responded to the call to protect Fiji and the lives of our citizens. And I commend them and their families. Integral to this national effort are the Rokotuis. Honourable Speaker, the Rokotuis, the Matani-Tikinas, and the Turaga-ni-Koros. They are responsible for 14 provinces, 189 Tikinas, 1,172 villages, 39,022 households, and 166,524 occupants. These do not include the I-Taukei settlements all over the country. They are, Honourable Speaker, part of the I-Taukei administration, which I head as the Minister for I-Taukei Affairs. Responsible for the good governance and well-being of the I-Taukei, the I-Taukei Affairs Act and its subsidiary legislation provide the legal framework for our work. Since its inception in 1945, it has gone through a number of reviews for one purpose only, and that is to improve the services of the I-Taukei. It has withstood the test of time, and it remains resilient. Mr. Speaker, a well-defined system and structure is easy to oversee and leverage. At the onset of the current outbreak, I had endorsed an introduction that was issued to the Rokotuis, the Matani-Tikinas and Turaga-ni-Koros to implement lockdown measures in all the villages. This was a proactive containment measure derived from the powers vested in me under the I-Taukei Affairs Act as the Minister for I-Taukei Affairs and the advice issued to the I-Taukei Affairs Board by the Minister of Health under the Public Health Act. And the purpose of this instruction was to secure the well-being of the villages. The Rokotuis, the Matani-Tikinas, and Turaga-ni-Koros were decisive in their actions, which were instrumental in protecting the villages. They undertook the following, Mr. Speaker. One, implement the lockdown instructions from the I-Taukei Affairs Board. Two, network with the NGOs, the CSOs, and business leaders for information sharing to reduce vulnerability. Three, mobilizing the Vanua, the traditional leaders, traditional protocols, and reinforce cultural values to support COVID-19 measures. We advise villages to implement COVID-19 protocols, i.e. practicing social distancing, restricting social gathering, enforce sanitizing and wearing of all masks at all times, and to establish safeguarding measures such as setting up of command centers and village task force committees to oversee the manning of 24-hour checkpoints, monitor curfew restrictions in villages, monitor maritime movements, focal point for the Ministry of Health, Fiji Police Force, and frontliners, and undertake public health awareness in all villages, assist in screening and contact tracing with the Ministry of Health, set up isolation centers, disseminate village profile information to relevant authorities, a focal point for food ration distributions in the villages, and organize shopping and barter trips for villages. Mr. Speaker, sir, the Rokotuis, the Matani-Tikinas, and the Turaga-ni-Koros are our foot soldiers in this area. Without your support, I want to say that enforcing COVID-safe protocols in the villages would be quite a challenge. They are also our link to the traditional leaders. As an unseen but very effective arm of the I-Taukei administration is the traditional leaders to the Mbosini Vanua. Their traditional reach has been very effective in enforcing COVID-19 measures. They too issued instructions to their respective Vanua. We clearly saw the integration of approaches because there's only one vision, and the vision is to ensure COVID-safe villages, a COVID-safe Fiji. Their swift response, Mr. Speaker, has proven the efficiency and effectiveness of the I-Taukei administrative system in normal times and, of course, during any crisis. Mr. Speaker, technology is a great equalizer. Through social media platforms, I receive daily updates on COVID-related activities in the province, in the tikinas and the villages, through the reports from the Rokotuis. These communication platforms are also used to convey daily updates from the Minister of Health to the Rokotuis and down to the village level through the Turaga-ni-Koros. The I-Taukei Affairs headquarters translate the updates into the I-Taukei language for dissemination across Fiji. And the same channel, Mr. Speaker, is used if I want certain interventions to reach the villages. Mr. Speaker, sir, the I-Taukei administration does not operate in isolation. The government acknowledges that defeating the virus requires a multi-stakeholder partnership approach. No one can do it alone. And to this end, support to the district administration is very critical. Led by the divisional commissioners, the provincial administrators and district officers have undertaken a massive task to support the Ministry of Health led by government operation to defeat COVID-19. While the Ministry of Health and Medical Services has been working to contain the transmission of the COVID-19 pandemic, the PAs and the DOs, under the leadership of the respective divisional commissioners, have been leading a multi-sectoral effort, including NGOs, including CSOs, and the private sector, to help reduce the impact of the pandemic. This effort has helped build the resilience of communities in the face of the COVID-19 pandemic, and it will also be critical when our communities and nation recover from the socio-economic impacts of the pandemic. Established 4 divisional emergency operation centers and their respective provincial and district emergency operation centers, or DISMAC, excuse me, to support the Ministry of Health with logistics support toward the COVID-19, and mobilize about 867 civil servants, which include municipal staff to report to the respective DOs and PAs through DISMAC. In addition to this, Mr. Speaker, 235 government assets, vehicles and boats have been allocated to the various DISMACs to support their work. These assets and personnel have contributed to the following activities: provide surge capacity for screening, provide logistics support for swabbing, logistics support for FEMAT Field Hospital, logistics support for and conduct of community awareness, set up and manning of call centers in addition to 158 and 158 and 161, coordinate and facilitate government food ration distribution in the Central Division, of course, and coordinate private sector and CSO food ration distribution and surge capacity and logistic support to vaccination programs. The COCs, Mr. Speaker, have been coordinating the response efforts towards contact tracing, mass screening, community awareness, and food ration distribution. In areas where government assistance could not reach, the machinery have fostered a positive partnership with the private sector. Has allowed the business to provide assistance to members of the community badly affected by COVID. We also coordinate with the Ministry of Health to ensure that despite the lockdowns and containment strategies, alternate strategies have been provided to ensure that our essential services are not disrupted and communities access basic services. The AOCs have been set up call centers in addition to the established 158 and 161 to cater for the public inquiries regarding the COVID-19 pandemic. In the Western Division alone, where the transmission started, where the Lautoka Hospital was compromised, and which experienced the first lockdown and containment in the country, a total of 26,000 calls were received from the public inquiring on containment areas, food requests, food ration requests, and accessing screening and swabbing facilities. To date, Mr. Speaker, a total of 44 community isolation facilities have been set up across the 4th Division. Thank you, Mr. Speaker.